Good afternoon, everybody. It's a huge honor to be here, participating and contributing to this conference. It's actually my first visit to Australia, and of course I built in some vacation time. My wife and I have just spent the last week thoroughly enjoying your beautiful country, and now I have this opportunity to learn from you. What I'm hoping to accomplish in the next 50 minutes is to share some of my experiences as a Canadian who does a lot of consulting with many different types of organizations right across our country about how Canadian employers and policymakers are really grappling with many of the same challenges that have been articulated already at the conference today. So what I've done is to try to basically expand the big theme of the conference. And I'm doing that by really posing a question. How can workplaces support and influence employees to be healthy, well, and productive? And it's that connection between health, wellness, and performance that really is the centerpiece of what I want to talk to you about today. I'm really going to be dealing with 4 related topics. I want to start out by making a connection as clearly as I can between health and performance. And I really want to acknowledge and give credit to the speakers before me, because really all I'm doing is kind of continuing from a Canadian vantage point a theme that they have very much established as important for the conference. I also know that many of you are health and safety professionals, and that's the role you occupy in your organization. So I want to connect with that first theme, occupational health and safety. And I'll say a little bit about that, focusing specifically on safety culture. Then I want to bump up the discussion to a much higher level and look at the entire organization and ask a question that many large Canadian employers are now asking, and that is, how do we build a healthier organization? Question mark. I mean, that's really getting beyond health and safety, that's getting beyond wellness programs, that really is pushing up to a much higher level. And finally, I want to talk about what I'm going to call the wellness dividend, and how you can take actions, and this, again, is based on my experience, based on what I'm seeing going on across the country in Canada, the actions that you can take to actually reap greater dividends from any investments, any actions, any commitments that you're making or taking in the whole area of health and wellness. Now, I mentioned that I've obviously got a Canadian perspective. It's interesting. I'm called the international speaker. Basically, I'm the Canadian speaker. I mean, let's be clear about that. But I have to say that I approach this talk with just a bit of trepidation, because I know that on the global rankings of quality of life, Australia always does better than Canada. I also know that on the global rankings of the top 10 cities that are the best cities to live in the world, Melbourne and Sydney always outrank Vancouver and Toronto, and that really, Canadians know about that. So I'm aware, and I could go on. I mean, the international metrics are quite revealing in terms of how well Australia does compared to other countries. So knowing that, I'm very careful about saying we've got it figured out, because we don't. So I'm basically going to draw on a point that one of the panel members just made, that we're on a journey. And so what I see is Canadian employers, Australian employers, Canadian policymakers, Australian policymakers trying to figure out, in their own ways, within their own contexts and within their own constraints, how they can make workplaces safer, healthier, and hopefully higher performing. So given that, there are things that we definitely can learn from each other. And what I'll do is start very quickly by giving you a quick overview of where Canadian employers see themselves right now, as far as the big challenges that they face. The first challenge is talent. In many sectors and in many regions of the country, we're looking at fairly acute skill shortages. And that is only being exacerbated by this basically demographic tsunami of retiring baby boomers. And there was a session this morning here talking about just that in the meteorology area of your government. So that's a huge challenge. And you know, it's interesting because that challenge, because it's demographic, has been on the radar screen for many years, but yet it's only now that employers are really sitting up, taking notice and saying, we need a strategy, we need a plan, we need to do something about it. The second challenge is engagement. And we in Canada, like you in Australia, do engagement surveys in large organizations. We also do national engagement surveys. And what we've discovered is that if you compare engagement levels pre and post recession, so mid-2000s with just a year or two ago, those levels have actually gone down. So employers are trying to figure out ways of actually boosting engagement. That's a huge people challenge. The third challenge is managing costs. Absenteeism in our country has been trending upward, right across the board. That's imposing a huge cost. Our health benefit plans, which are basically employer funded and to some extent subsidized by employees. There is a cost share involved in many cases. Those costs have been going up. The cost of long-term disability, that's been going up. So rather than trying to cut back on these programs, which are essential, especially if you want an engaged workforce, employers are saying, how do we actually get down to some of the root causes and find ways to address those causes so that we can maybe free up some of the money that we're now spending on prescription drugs and put that into health promotion in the workplace. So all of this has really kind of galvanized the focus of, I'll say, larger and more progressive employers, not all employers by any stretch, at the question, how do we create healthier, safer, and more productive workplaces? This little diagram is a way of depicting kind of where employers sit in terms of connecting their activities around workplace health promotion and the performance of their business, or if you like, the strategic connection between health promotion and business success. Many Canadian employers have simple programs that just address individual risk factors. Classic example, smoking cessation. Another would be flu shots just before flu season. And they're standalone programs, that's it. Other, and I would say leading employers, have much more comprehensive programs. So they have employee assistance, they have many of the resources that you've just heard about dealing with mental health. They may have on-site fitness facilities. They certainly have physical activity programs. A few are starting to introduce health risk assessments as an online tool, which, by the way, are very common in the United States, far less so in Canada. And they've got comprehensive programs that address the mental health issues, physical health, and basically social well-being also. So, and they bundled them together. Now, what's interesting is that if you get leading employers in Canada in a room together and ask them what they're really trying to do, they will say, well, actually, what we would like is to create a healthier organization. We want to find ways to actually get more performance impact from the actions we're taking and the investments we're making around health promotion. So the language in Canada among the leading and large employers has changed. It's now organizational health, or healthy organizations. But I view that language as almost strictly aspirational. They're basically saying this is where we want to go, rather than this is where we are now. So many of the larger employers really sit in the middle of this graph. And I'm interested. You know, there's quite a few of you here. How many of you would say that you have comprehensive workplace health promotion programs? This is time for a some mini exertion. Put one hand up if you have a comprehensive workplace health promotion program. How many of you are aspiring to be a truly healthy organization? Put your hands up. Now that's interesting. You see, we have more hands going up for that than, okay, so this is fairly representative of what I would find asking the same questions of a Canadian audience. So let's turn now, because basically that aspirational language is saying we need to find ways to connect everything we're doing around health and wellness with organizational performance. So let's look at some of those connections. What I'm going to suggest to you is that the biggest connection that seems to be kind of the missing piece of the puzzle right now is with employee engagement. Because many of the large employers, in fact, I would say without exception, large employers in Canada and in the United States as well do employee surveys that oftentimes are just called engagement surveys. And they are tapping on an annual basis, many of them, the level of engagement in the workforce. However, those surveys are done in a separate part of the organization, usually by HR. Wellness is done over here, and then occupational health and safety is back there, done by somebody else. So you've got these basically three silos in these organizations with very little interchange. And that's something that really must change if the aspiration to become a healthy organization can be achieved. So what I'm suggesting then is that the real connection here is between everything you do around health and safety and performance. The missing link and the big connection has to do with engagement. And there's a lot of evidence that speaks to this. I'm only going to share a little bit. There's actually truckloads of this evidence. Right now, there's not just single studies we can cite. There are studies that are called meta-analysis, and thank you to Professor Parker for giving a short definition of that type of research this morning. Basically, it's a study of a study where you pull results from all kinds of other studies. So you can see whether it's the area of job satisfaction, whether it's the area of job stress, or whether it's in the area of job performance, researchers are from those different angles showing that there are connections between how people experience their work and their health, their sense of well-being, the level of stress that people experience and their ability to perform their job, and in terms of the job performance, the kind of supports they have, the environment they work in, and their ability to do their job. Now, what's really interesting is that there's a lot of convergence, because if you look at the factors that are identified in these three really quite distinct areas of research, they're talking essentially about the same underlying ingredients in the workplace that influence all of these things: stress, satisfaction, and performance. So again, that's where we need to be making connections. Here's a very interesting example of how, increasingly, employers are making that type of connection. This little happy face logo actually was right on the front of the Harvard Business Review about 2 years ago, because the Harvard Business Review, which in North America, I don't know if it's widely read here, but it is the must-read magazine for chief executives and people in the C-suite, as we would say, in North America. And so they devoted an entire issue to happiness in the workplace, because there's really been a deluge of research over the last decade it's in the area called positive psychology, and it's looking at how happiness, which really is another word for psychological well-being, how happiness influences people's job performance, and flip that around, how people's job conditions influence their happiness. So what this magazine was showing is that basically happy employees are more productive employees. Anybody in a customer service role dealing with a happy employee is going to go away as a happy customer. So it kind of, it's infectious in that way. So basically, it's good for performance. This, of course, simply puts right at the front of the agenda issues around mental health in the workplace. And Canadian employers have taken actions similar in some ways to what Australian employers have taken, developing resources and trying to find ways to really address the costs of mental health in the workplace. We've been helped, as you have, by some policy level activity. So we had a mental health commission, a national mental health commission, and the mental health commission documented that 20% of all absenteeism costs are mental health related. 30% of all long-term disability is mental health related. And I don't know how they actually calculated this number because it's an enormous number, but the cost to the economy and society of mental health problems is $51 billion. So it's enormous. Absolutely enormous. Now, this, of course, was a huge spur to action. And one of the things that happened was just a year ago, it was the Mental Health Commission partnering with some large employers, funded by some large employers, and partnering with an independent body that really assesses standards. And so what they did was they created a new national standard for psychological health and safety in the workplace. And they modeled it around basically occupational health and safety management systems where you assess, you plan, you introduce an intervention, you evaluate, and you improve, and it's that cycle. So anybody who in Canada who has a well-established OH&S management system could easily adopt this standard. That was the intent, which is actually a very clever way of trying to roll something out, because rather than saying, hey, this is brand new, this is entirely different from anything you've ever done before, they're basically trying to speak directly to the occupational health and safety community, which actually in most organizations has more influence because it's got some legislated requirements than the wellness folks in the organization. So speaking to the OH&S professionals and saying, look, this is an easy add-on to what you're already doing. That's the real intent here. Now, what's, I think, very powerful about this new standard, which is, by the way, entirely voluntary, but nonetheless, it's been quite influential. So what it's done is it said, okay, yes, we need to help and support and provide resources for those individuals who bring mental health issues into the workplace. Absolutely. And we need to reduce and eliminate the stigma around mental health. Everything you heard the panel say. Absolutely. At the same time, it provided a whole set of tools and resources to actually address how the workplace itself contributes to mental health problems. And that's, I think, the powerful piece here. So what it has is an assessment tool that looks at workplace factors that contribute to mental health. It has some very, very good checklists for senior managers and also for union leaders, recognizing that in many workplaces there will be unions who have to be partners in this. So it's got quite a lot of resources. They're all free. I've given you the website here. I'm seeing a lot of convergence, though, around the tools and resources you have and what has been really created for this national standard. But you might find something that is new, that does work for you, so I'd encourage you to have a look at it. Well, where does safety fit into this? Now, I've just mentioned that, okay, so this new national standard that's intended to help employers grapple with mental health issues in the workplace was using occupational health and safety management systems as a springboard. So that does suggest that there are some real potential connections between safety, well-being, especially psychological well-being, and performance. I very briefly want to look at another connection in that regard. And that connection is safety culture. In my experience, again, I'm speaking as a consultant who's worked with a lot of organizations, really trying to help them find ways of developing and implementing a very kind of robust workplace wellness strategy. What I've seen to be effective is to make a connection with safety culture. Because as this slide shows, the ingredients of a safety culture, which are described in the left-hand box, the ingredients of a safety culture, the type of supervision that it requires, the kind of working relationships that it requires, the kind of people leadership that it requires, those at the very same time are the ingredients of a psychologically healthy workplace. The other big connection that this slide shows is between the presence of a strong safety culture in a workplace and other quite important HR goals in the organization, like people's sense of pride at working for the organization, their commitment to the employer, and their job satisfaction. By the way, this comes from a very large survey that my team and I did in the province of Alberta among 11,000 healthcare workers. So it is in the public sector. It includes healthcare workers in a whole range of healthcare occupations. So that's the connection. Here's another connection between safety and engagement or performance. This also comes from healthcare, but a different province and a different study that I was also involved in. This is Ontario, and this involves dozens of Ontario hospitals and all the employees in those hospitals. And what I've done on this slide basically is, because it's a different type of survey than in the previous slide, and the focus of this particular survey is really to look at healthcare workers' overall work experience, including their level of engagement. So basically all I've done is break down the respondents to the survey into 3 engagement level groups: high engagement, medium engagement, and low engagement. And what you can see is that the high engagement group, it is very unlikely to say that in the last year they've experienced an accident, an injury, or an illness as a result of their work, because they are much more in control of their immediate work environment. They've got that safety culture. They can anticipate and do something about a hazard in the workplace that could either cause them an injury or an illness. So that's a very, very, very important connection in terms of safety and engagement. So I know that I'm speaking to the occupational health and safety professionals. How many of you are occupational health and safety professionals? Use your other arm just to even things out here to answer this question. Okay, so that's good. So that's why I've put this in. It's an insight that I think is a growing insight among occupational health and safety professionals in my country. If you go to big OH&S conferences that are on this scale, increasingly you hear this kind of talk. Okay, so now let's again shift our gaze to a much higher level, and that is to the entire organization. I mean, here we are. We're talking about health, we're talking about safety, we're talking about performance. Those are really all qualities of the organization. So by thinking healthy organization, what we're doing is really applying or looking at the entire organization through the lens of health. And that gives us a much more integrated, systemic, if you like, long-term view of the organization. And it gets us to ask questions about how do we design the organization's systems, its structures, its relationships, its culture, so that the organization itself and its workforce is agile, is resilient, is high-performing. Those are the kinds of questions you can ask of an individual in terms of health. You can ask them of an organization. And by looking at this organizational level, you can also see ways that the people practices of the organization can become far more sustainable. So it's really about sustainable success at a human level in the organization. It requires, however, a much more robust approach to addressing health and safety issues. You really have to go upstream, as it were. You really need to get down to the root causes. So rather than just trying to come up with a better absenteeism management program or come up with a better program to address long-term disability and so on. I mean, as important as these are, you really need to look at what are the root causes. What are the things in how people's jobs are designed, in their working relationships, in the culture, in the style of leadership in the organization that might be driving these trends upward in the first place. And that's what the healthy organization perspective can help you to do. So a couple of years ago, I published a book called Creating Healthy Organizations. And I actually think that's why I was invited here, because of that book. Somebody on the organizing committee read the book. And all I'm doing in this slide is describing the building blocks that are the centerpieces of the book. The first is culture, and I just call it positive culture because I put culture on a continuum from positive to negative. I'll give you a couple of examples in a moment. Then we have leadership, and we've heard, I think, examples of the kind of inclusive leadership that's essential. In fact, the opening keynote talked about it. Everybody in the organization needs to be a leader. That's inclusive leadership. And the third building block is the vibrant workplace. And I use vibrant because I was looking for a word that really took us beyond just healthy. Healthy tends to encourage people to just think about individual health and reducing individual health risks and health promotion programs. So I wanted to go beyond that. So, yeah, I mean, I'd run a lot of workshops in a lot of different organizations with employers, with managers in particular, and asked managers to describe the kind of workplace they wanted, and they use words like vibrant. They didn't talk about healthy, so that's how come I chose that. Anyway, it's beyond health. That's all I'm trying to signify here. So these building blocks really are what have to be in place, and recognizing that they're all very much a work in progress. It's not like you in some ways, the metaphor here really kind of has a limit because it suggests that, okay, you put something in place, it's there, and then you can move on to the next. Actually, these are all works in progress. Okay? You're constantly working on it, constantly refining, constantly improving. But they're what lead to that sustainable performance in the organization. So let's look very briefly at culture. And I've got two examples on the positive end of the culture scale and the negative end. And I want to use these examples to show how simple the concept of a positive culture is. Some of you may have heard, and they're Canadian examples. I mean, why not? I am from Canada, and here I am in Australia. So why not share a couple of Canadian examples with you? And the first is the Four Seasons Hotel and Resort chain, and they're a Canadian company. Well, actually now they're, Bill Gates and a Saudi prince, I think, are the major owners. But at any rate, they started out as Canadian. You know how things go in a global economy. And they are a Canadian success story. And the founder of the Four Seasons wrote a book published a couple of years ago called The Four Seasons Story. And basically, he talks about the business philosophy that built this very successful, very high-end 5-star resort chain. And the business philosophy is astoundingly simple. It's the golden rule. Treat employees the way you want to be treated. Because if you treat employees that way, they will treat guests that way also. So it's this beautiful kind of trickle-down approach, right? Where everybody's treating everybody the way they want to be treated. And this translates into every language. It makes sense in every religion and in every part of the world, because the resorts are in all kinds of different places around the world. So it's compellingly simple, and it's been a key to the success of the business. And the founder and the CEO, he just retired, says that it's so simple that we can talk about it at every team meeting. It makes perfect sense when we even have very short conversations with employees about how you're treating people. The second example, we're moving now to the far other end of the continuum, is just a terrible, terrible rail accident. Well, it's not an accident. Basically, it was an explosion, entirely preventable, a year ago in a little town in Quebec called Lac-Mégantic, where a fully loaded railway train with highly combustible fuel from out west, because we produce a lot of oil and gas in Canada. So it had some ultra combustible oil in tank cars. It was parked up on the top of a hill without the overnight, without the brakes properly applied. It rolled backward down into this small town, exploded, and it basically wiped out the whole downtown core of the town and killed 47 people. The Transportation Safety Board of Canada just released its report, and it said there are multiple causes to this terrible tragedy, but one of them is the complete absence of a safety culture. And it talked about how if there had been a safety culture, it's very, very unlikely that this would have happened. So that's where safety cultures play a huge role in terms of, well, in this case, averting catastrophes. And another similar example would be the Space Shuttle Columbia disaster 11 years ago, 2003. NASA's inquiry into that disaster pinpoint, it wasn't the tiles that flew off the space shuttle as it re-entered the atmosphere and burned up. Rather, it was a culture, to quote the NASA report, it was a failed safety culture. So culture is big when it comes to safety, when it comes to well-being, and when it comes to performance. Here's another example. This comes from the Ontario healthcare surveys that I mentioned that are done in hospitals. And I've been working closely with Ontario hospitals doing these surveys. So this really draws on that data. And what it shows is that culture is often this soft, mushy, intangible part of the organization. But actually, it starts making sense to people when you talk about things like trust. People get that. So what we found in these hospitals is that high-trust cultures, where employees trusted their managers to take their interests into account when making decisions, and managers trusted employees to do what they can do best in their job. So that's a two-way street, that trust. That contributed big time to high levels of engagement, which in turn, so people are feeling engaged in their job, and there's multiple dimensions of engagement. It's emotional, it's behavioral, it's cognitive. People feeling really engaged, really absorbed in their job. So it's not surprising that those workers will report that the teams that they work in are much more focused on patient needs. That's called a patient-centered care environment in Canada. And that they are also going to be focused on basically identifying and eliminating safety risks to patients, which is a patient safety culture. So at the same time, these employees are experiencing low stress and fewer injuries. So it's really a triple win. It's a win for the patients, it's definitely a win for the employer, and big time a win for the employees. So this is the kind of culture, a high trust culture that we need. Now the problem, of course, is when we start talking about culture, many organizations, even those who talk a good line about culture, have very weak values. And nobody's laughing. Do you not get Dilbert cartoons in your newspapers here? Sure. Well, even if you don't, I mean, Dilbert is the prototypical cynic in the workplace. Every workplace has, in fact, you hope you only have one Dilbert. Let's put it that way, right? If you have more than one, you are in trouble. So Dilbert is the classic cynical employee. And he's raising some very good points here, because many organizations have values that are plaques on the wall, they're on the website. How many of you know the values of your organization? Let's have a moment of honesty here. Put your hands up if you know the values of your organization. Okay, so this is a good sign. So really what we're getting at here is the importance of having strong, shared, meaningful values that are translated into behavior. And that link to behavior is a theme that others have made already today at this conference. So how do you do that? How do you actually translate those behaviors or translate those values into behaviors? Well, let's look at what I consider to be the key elements of a vibrant workplace. And you'll notice that right at the top, this is looking at how you design that work environment. So right at the top is respect and fairness. Respect is a value. It's something that people hold dear to their hearts. But it only is meaningful if it is demonstrated in each and every interaction you have in the workplace. So you need to basically build it into working relationships and relationships with clients, customers, the public. Now, it's important to note that the national standard for psychological health and safety in the workplace that I mentioned earlier really identifies respect as a key ingredient of a psychologically healthy workplace. Okay? So that is critical. Let's move to another area of expertise, safety cultures. Interestingly, safety culture research suggests that if you don't have respectful relationships among team members and between a supervisor and those reporting to him or her, people are not going to speak up. And you need that to happen to really have a safety culture. So respect is really a prerequisite for safety in the workplace. Two-way communication. Well, it's interesting, as we work down this list, so much of it, like two-way communication and like respect, are common sense, are obvious, are things that we all know are important, yet are so painfully difficult for many organizations to successfully implement and maintain. The other observation, if you just look at the list here, I mean, there's a couple of items here that might have dollar signs beside them because they cost money, but let's just stick closer to the top. Making a personal commitment to be respectful in all your interactions costs you how much? How much of a budget do you need for that? Anybody want to answer that question? 0, right? I mean, these are many of the things on this list cost absolutely nothing. So that's where the values become important. And that's where being able to actually say, look, we are doing this because it's a core value of the organization. This is who we are. This is how we operate. This is how we work together. And reinforcing that. On that point, I want to emphasize one further detail. You probably are aware that when American employers introduce workplace health promotion programs, wellness programs, and so on, they want to immediately calculate the ROI, the return on investment. And there's reasons for that. A private healthcare system in the US where employers pick up a good chunk of the tab. But in Canada, while employers are interested, it's not a must-have for them to go ahead and introduce a workplace health promotion or wellness program. So what I'm seeing among Canadian employers, and some of them actually talk about this, is by introducing a more robust wellness initiative, what they're seeking, and this is a very interesting twist, they're seeking a return on values. So it's an ROV, not an ROI. Because by doing that, by introducing that wellness program, they're reinforcing the values of the organization. They're showing to employees that, yes, we care, yes, you matter, yes, you are the basis for our success. So just a couple of, that's a bit of an aside, but I think it's an important one. If we look further to shift back to the vibrant workplace and look at the ingredients, we can see that autonomy, giving people control over what they do, respecting them, if you like, to actually be able to make decisions and figure out how best to do their work and manage their workloads. That is a key to addressing the root causes of stress. So that vibrant workplace design really can get at the stress issues that many organizations are facing. The other thing that it gets at is the fundamental basis of work motivation. Now, there was, for most of the first 3/4 of the 20th century, kind of the carrot and stick thinking about motivation. Basically, it's money that motivates people, and you punish them. In other words, they don't have a job if they don't work hard enough, and that's it. Well, that thinking has changed. I'm basically drawing here on a New York Times bestseller. This book, it's called Drive, What Motivates People. I don't know if it's popular here, but definitely it's a bestseller in North America. And what it does is it talks about, essentially, from a psychological perspective, what is it that really motivates people? And the conclusion is people want autonomy. They want purpose. They want the ability to get better at something. That's that sense of mastery, to essentially unleash their potential. Those are all of the things that if you go back and look at the ingredients of a psychologically healthy workplace, they're all on that list of what defines a psychologically healthy workplace. So this idea of designing a workplace so that it can be at the same time contributing to well-being and higher levels of performance is actually a pretty straightforward thing to do. When you look at those ingredients and when you recognize that many of the ingredients that I've showed you that are listed in that new Canadian National Standard, they are common sense. So it really is a matter of trying to break through that inertia in many organizations and say, okay, let's do what we know needs to be done. So let's now look at how you can do that. And I want to suggest that the biggest wellness dividend, because I was asked to talk about wellness, workplace health promotion, how that connects with safety, how that connects to performance. So what I'm going to suggest is the biggest wellness dividend of all is really a truly healthy organization where employees are inspired to come to work, where you have a very high level of engagement and retention, and you've got basically a sustainable model in terms of the business. So that's really the big dividend. How do you do it? Well, again, there's no rocket science here. Let's go back to a very basic definition that will be familiar to any of you who are in wellness positions in your organization, and that's the World Health Organization's definition of health promotion. This definition can be read as a definition of organizational development. Basically, giving employees, if you look at the words that are kind of in red, giving employees or enabling employees to control their work environment so that they can actually improve, and I would just add to health, their health and performance. That's it. So, and this, by the way, is the message that Professor Sharon Parker provided in her session this morning. You need to participate. You need to use the word engagement not as a noun, as a goal, but turn it into an active verb. And you need to engage your employees in anything that is going to lead to a healthier and a safer work environment. And that's the big, going back to my big connection that I tried to make early in the presentation, that missing link. You need to build in engagement. So let's just try to do that in terms of wellness program designs. Because if you look at how wellness programs are designed, often they're just kind of plopped, they're dropped from the top down into place. Very little input from employees. So the first thing is you really need to set up and empower local committees. And if those are local wellness committees, they need to build bridges with existing occupational health and safety committees, which I'm assuming are mandatory in Australia. They certainly are in most jurisdictions in Canada. So they already exist, they're already there. So you need to build those bridges. The third thing you need to do is you can actually foster, why is it that the average level of participation in employee wellness programs in North America is about 30 to 35%? Because many employees, they're demoralized. They're disengaged from the organization in the first place. Why would they participate in anything the organization's offering? So you need to recognize that more engaged employees are more likely to participate. And the flip side of it also is true, that as employees are feeling healthier, as they're feeling a greater sense of wellness, that is you've got this positive upward spiral happening. They are going to feel more connected to the organization. They are going to be more engaged. So again, there's big connections here that can be made. Now, I want to end with a very quick overview of some of your challenges. And all I did, I did a little bit of digging around for the talk and discovered some very interesting documents, studies, reports, surveys. Here's a couple here that speak to how your government, your employers are articulating the challenges they face. And when I look at this, I see these very easily could be Canadian quotes, okay? The challenges are identical. So really all I'm encouraging you to do is to say, okay, so, there's different ways of coming at the same issue. I was interested in the previous presentation to see European comparisons, some of the things that we're struggling with, how we kind of work through them and try to deal with them might be useful for you. That's really the key point here. So I want to leave you with 4 quick takeaways in terms of how you actually can create that healthier organization, make those connections, address those challenges on the previous slide. The first is to view well-being basically as an indicator of the future capabilities of your workforce. That's really key. And it also is an indicator of future costs if you don't deal with health and safety issues today. Second thing is that you can boost employee morale by promoting well-being. That's the engagement, well-being connection that we talked about. The third thing is that you can encourage a culture of health and safety through employee participation and ownership. This is the inclusive leadership piece. Employees can drive this. You need to be behind it as the manager. You need to really be the champion, but certainly it's employees who really need to carry it forward. And fourthly and finally, you need to integrate wellness actions and goals into your engagement strategies, because I know many of you will have those engagement strategies. But most of all, each of you need to be a change agent. You need to do many of the things that you know must be done, because I'm sure that I'm simply reinforcing what you already know in terms of the ingredients, the root causes, the drivers of a healthy, safe, and high-performing workplace. Thank you for your attention.